Hello, I'm Echo Menges for NemoNews.net and the Edina Sentinel, and this is Lori Moots-Clair. She is the administrator of the Knox County Health Department, and this is our COVID-19 update. And so, Lori, we have a kind of a long list of things to talk about.
We do.
First, let's kick it off with all things COVID-19 testing.
Yes, here in Knox County, and things have changed. It's probably been a week and a half since we last talked, probably closer to a week and a half. We had set at 25 tests for quite some time. We started getting the negative rosters from the state, and turns out there is a lot of testing going on right now, and what I've determined that it is a lot of procedures are going to start occurring in the hospitals across the area and with the doctors. And so local residents who are planning to go get an orthopedic surgery or any kind of what they would consider elective, they're requiring that they have a COVID negative test first. So we have a lot of citizens who are going to Columbia or elsewhere right now to get COVID tested, to get clearance for a surgery that might be occurring in a week or two. So they are popping up on lists of mine as negatives, and we are now at a total of 40 negative tests. So that's 1% of our population, and still not very good, but at least it's some random sampling. I mean, I'm happy about that. For everyone that goes and does that, that's a random sampling of our community that shows that, again, it's not there. Most people have heard on the news over the last couple of weeks the Triumph situation in St. Joe. We know that they're testing now up at Smithfield and Milan. So there are people who are completely asymptomatic who are testing positive for COVID. So the more we keep dabble testing for these procedures, chances are we could hit on something, which is why we tell people to keep up with the social distancing. But
so just to be clear, we still do not have a confirmed positive test in Knox County.
No confirmed positive cases in Knox County, and we are now one of 13 counties. And so just earlier today, they announced that Schuyler County has their first case, which means we've kind of watched that trickle down. Of the counties in the state of Missouri, we are 1 in 13 right now that do not have a positive case. A lot of that, and I've said that from the beginning, is attributed to lack of testing. So 1% of our population, which is essentially 40 people, not a lot of testing.
Very low amount of testing, so it's still pertinent to say to look at the testing is meaningless.
Treat it as if the one thing that the Triumphs and the Smithfields and the factories, the thing that's teaching us is that there are asymptomatic people that are out in our world every day working with us, socializing with us. They don't even know they're sick, and they're carrying this thing, and they can spread it, and it is a matter of the strength of the person getting it as to how sick they're going to get and the strength of the immune system. So you have to still treat it. Social distance by 6 feet and treat it like it's here. But as of now, 0 positive cases.
And very little testing. With the caveat that we're really not doing a lot of testing. Okay. And then I just wrote down like a couple of questions because I thought it would be pertinent to explain to people why haven't we done any or more than one test from the health department? Why is the health department not doing COVID testing?
And so that's a question that is really picking up as people begin to need this screening test for these other elective procedures. They're being told, and many places across the state, at the larger health departments, they can go there and get a COVID test. So in the county of Boone or in Columbia, some of the doctors are saying, go to your local health department. So I've had some calls, and we do not have testing supply. We have not been given PPE to cover all the staff in my building should testing have to occur. We have yet to be funded at the local public health level in our county for anything COVID related. So it is just something that we can't do. And with limited staff, it would be essential that we had the proper, and when I say PPE, that's personal protective equipment, it would be essential that we have that. Because right now the testing still includes the nasopharyngeal swab, which is the one that goes back the nose to the back of the throat, makes the individual gags and makes them cough. We would want to be sure that we were well prepared for that in the event that one of just a very few nurses got sick from doing it. So we have not done that. We've not been prepared both with testing supply or with PPE.
And so, and does the health department rely on the state, the Department of Health and Senior Services?
Yes. So what's happened is in the areas where COVID has been prevalent or there's been an outbreak or a hot spot, I think that, people have stepped in to make sure that that testing occurs, and the hospitals have covered that, and the physicians have covered that. For our area, we have relied on our partners at Scotland County Hospital, our providers here in our area, providers in Kirksville, the urgent cares. We take the calls from individuals in the county. We assess their symptoms, and if we feel that it could be COVID related, we refer them out to places we know that do testing. And so that has been our practice, and that will remain our practice until the state prepares us in such a way that we could assume COVID testing.
Okay, and because I remember at the beginning when you guys you had 2 tests from the state.
So kits, and that's the other situation. When this all started, they sent 2 kits to every single health department, and we were supposed to hold those kits. And when individuals or practitioners called the COVID hotline at the state, if they felt they met the criteria, which at that time was travel, symptomatic, etc., they would approve it. They would call me, say, take that to the ER of wherever or the doctor of wherever for your county resident. We distributed one of the 2 because it was just simply hard to get a test and meet all the criteria that was coming forward with that. So that was the state lab test. Now the Quest tests and the LabCorp tests and some of these private labs, the hospitals and the physicians had the authority to make that call on their own without calling the state and getting approval. So we saw a lot more of those tests come through, and we were very appreciative of that. I know several were ran through Scotland County Hospital. We worked with them on a regular basis, as well as our local clinic and then the urgent care in Kirksville.
So how many of the original 2 tests that the state gave you, do you still have one left?
Still have one left. Mm-hmm.
The state hasn't given approval to test anyone with
Not
that
to
test?
use it. Mm-mm. No. And right now, so like even the individuals who are calling me today saying that they're going to have an elective procedure in a couple weeks and they need a clear test, that would not, even if I had the supply to collect that test, that wouldn't meet criteria to be done. So it's essentially
okay.
Yeah.
So basically it's the Department of Health and Senior Services that is making the call on what you can do with the state provided test.
Right. With the state provided tests, they have to tell me where to take them. I had asked if I could take them and just give them to the hospitals or doctors so that if somebody showed up, it would make sense to me that they would be in those hands. That's not the way it works. They wanted those people to call to them, and then they would approve that test, and then they would call me and say, take them the test. So a lot of barriers to use with those lab tests. And there's a reason for some of that too, in that they wanted to verify that they were high risk, that there were things going on that, required that test. So, because testing supply is limited. It's been limited everywhere. We heard on the news yesterday that finally, I think they had Quest. Quest was on the governor's feed. Finally, they are under what they can do. So more tests could be put out there to them and they could still handle that. But I think we're at a place where less tests are being requested because people are ill, and more of the testing is the kind of the hotspot testing or the surveillance testing, like in these meat plants and these factories, just to kind of see where it is. And thank goodness we're doing that, because what it's showing us is in places like Triumph or Smithfield or wherever we're going with those, we're finding that people can be completely asymptomatic, feel fine, and still be a carrier for COVID. So
yeah, I think it's interesting. From the beginning, all of the state resources seem to all be kind of focusing on the more populated areas, different hot spots, just kind of places with more people. More people,
yeah. And from the very beginning, I did not have a problem with them saying LPHAs would not be first line for PPE, the personal protective equipment, because the people who needed that equipment were the doctors and the nurses and the EMS crews that were seeing these acutely ill people and needed to be protected while they were dealing with them. We're making phone calls, we're quarantining, we can do things from a distance when we're not doing testing. So don't think that I'm complaining that they haven't given us the PPE, because absolutely those things should be in the hands of people who need them for patient care. But when we get to the point that there's enough PPE that we then have them in our facilities, then we start talking about our small entities doing testing and different things.
Okay, so that's where we are with testing. And then I know you've been talking a little bit about Smithfield testing.
So
Smithfield's in Milan, Missouri, by the way, which is not in Knox County. It's in Sullivan County.
Right, and I can't remember what it was called before, but people are very familiar with Smithfield at Milan. I think historically we've had people from Knox County that work up there and make the drive. Kind of started a few weeks ago when Kirksville had so many tests. They were doing kind of before May 4th, they did a kind of a push to get so many tests in certain populated areas. And about that time, they did Triumph over at St. Joe and realized that the factory setting was a hot spot. And then we had some factories in Iowa that became hot spots. And so the question was that we just were not getting enough testing in Northeast Missouri. And the partners over in Sullivan County, led by the health department and the hospital, with the support of the state, decided that they could test employees at Smithfield. And my understanding is that started on Monday. And they've got testing that they're going to do all week. And then there will be tracing based on the positives that come back. I don't have the official numbers from that. I do know they're seeing some positives because KTVO released yesterday that Adair County Health Department was trying to track down 4 that were positive from Adair County. So they were asking people who worked at Smithfield to please call in and discuss any contacts they might have had, as well as to if they wanted to be tested. So I would say that same thing to Knox County residents. If you work at the Smithfield plant in Sullivan County and would like to be tested, get in touch with us if that's not been made available to you, because we can certainly call over to Sullivan County Health Department and see if we can get you in line for some testing.
Well, and something else, people who are interested in data and following it, there's, Johns Hopkins, and the state actually does a county by county listing. It's updated daily, maybe even more often than daily, with new cases on a county level. So while just as a reporter, I'm not expecting notification from Smithfield, directly or in a public information capacity. But one thing I will be watching very closely is that state data sheet count on county level, and I will be looking at Sullivan County, thinking of all of this increase rate of testing they're doing over there by doing, so much testing. And I'm not even quite sure how many tests they were planning on doing, but I will be watching the Sullivan County numbers to just kind of see, how
what comes out of that.
How many, if many more.
What's interesting is that we are transitioning into a different phase of COVID. So we waited for it to get here, and then it seemed like all the testing, the supplies were limited, so all the testing was sick individuals. If you were sick and if you had traveled, you were getting tested. We are now seeing the availability of testing supply increase, so we're doing this surveillance testing, which is great because it's gonna pinpoint places that are at high risk and allow us to move in and take care of those without having the widespread problems that we could see. So it's a different phase of the problem, but we are
and we're seeing those testing elsewhere. The surveillance testing elsewhere. We're not seeing that.
We are not
in our rural
and it's
community.
kind of what we've said that we don't have the large factories where people are elbow to elbow. We don't have the congregate living situations. I've told people over the last few weeks that all things considered, just living in Knox County makes it a safer place to be. But it does not make us exempt because we travel out to work in these factories. We have friends, we have family members. And then, of course, you've heard me speak repeatedly. People are going to become offended by my speaking about the need to stay home and not go to the metros right now and not bring your kids home from the metros, because those are the places where active disease is still spreading. And we need to just slow that traffic into Knox County, and it's going to keep us positive free for a longer period of time.
Yeah, we'll just keep going because there's
there's
so many.
We could talk testing forever.
It could be a 4 or 5 hour long live stream. We're going to try not to do much shorter than that. Okay. before we get off the complete testing topic, let's talk about immunity and antibody testing and what you think, right now.
Of antibody
with the
testing.
caveat that could change.
Changes
because
every day.
that happens a lot. Things change.
So I am very interested in seeing antibody testing come to Knox County. Antibodies, there are short-term reactive antibodies that when somebody is immediately sick, the antibodies spike up, and then those kind of drop off, and then there's a different kind of antibody that kind of stays and builds up, and it shows us that, hey, we have some immunity to disease. We often see this with like the hepatitis because we give vaccine for that. We also see, we've talked a lot about tick disease in our area. So when somebody's tested for tick disease, those come back. And sometimes the numbers will say reactive, non-reactive, gives us a sense of whether they've had a historical disease or whether it's something current. So I am anxious to get antibody testing started here in Knox County. I think for those people who have sat out there and wondered, could I have had this when I was so sick several months ago? Could I have had this when I tested negative for the flu, or could I have had it along with the flu when I tested positive for it? It's going to answer a lot of those questions, and it's maybe going to tell us what the potential was. We can do our own kind of surveillance. The important part of doing the antibody testing, though, is that it be accurate testing. And right now, this antibody testing is brand new. It might cross-react with other coronaviruses, which people out there know coronaviruses have been around forever. They've even got them on your Lysol bottle, the common cold. We don't want it to pick those up. We don't want false positives. We don't want false negatives because there's trailing and work to be done with each of those things. If somebody has positive antibodies, then we have to figure out, is it a current disease? Is it a past disease? And there's the whole quarantine and all of that stuff. So what we need those tests to do are to come around to being as definitive as possible. And when that happens, hopefully we'll get some funding here and we can, as a health department, draw some blood. It'll be a simple tube draw, and we can send that off and just do some testing. Let's test all the healthcare workers. Let's test pods of people that are interested, that have just been out and about. I would really like to see that happen. State of Missouri told us as recently as last week that they felt like it was something that was a valid point for surveillance for our small rural counties that haven't had much testing, but that we should hold off just a little bit, that significant changes will come in the next 2 to 3 weeks with regard to antibody testing. Mm-hmm. And I think when the state health department, my kind of go-to is the state lab. When the state lab picks it up and says, hey, this is good stuff, it's going to be tried and true and ready to use. So when we have that opportunity, we're going to jump on it, and we're pushing for it right now. I ask about that repeatedly with every survey we have and with calls. We want to test our people because I do believe it's been here. And I think if we could say to people, hey, it's been here,
we're not immune.
Yeah.
We now have, although we just don't know.
We just don't know.
Okay. Do you want to talk anything else about testing before we...
I don't really about testing, but it's
okay.
Probably a good point to talk about what services. So we can't test you at the health department for COVID right now, but our other services are up and running. We do still have our front door closed, and we're taking appointments. So everybody's used to the health department being walk-in clinics where you can walk in every Tuesday and Thursday, and there's a nurse there, and we'll take care of you. We still want to take care of you, but the walk-in is not going to start back up for a while. We're still going to do it by appointments. We're going to do it by calling us from the parking lot, and we'll come to you. And there's a couple of reasons for that. I have a pretty small staff. For a while, we were working staggered shifts because if one of us got exposed, chances were we were going to infect everybody else. Mm-hmm. So we split into 2 shifts. Now we're all back together, but we still have a very limited staff. So we have all the walk-ins, but then we also have this population of home health patients who are acutely ill at home getting better. And it's our job to make sure we stay as healthy as possible, to go out and take care of them, and we don't take anything into them. So we are taking precautions within the health department to make sure that our children who are coming in for vaccine for other things, because we still have to stop pertussis and the whooping cough and measles and varicella. We still have to do all those things. We don't want to take the chance of infecting them with COVID when they're at their county health department to do that. So we're keeping the door locked, and we're doing it by appointments. And anybody that's got a question about that should call me directly and pull up in our front pull up in our front parking lot and honk at us. It's not, I always feel that way when I go to City Hall and I have to honk at them to get I always apologize because I feel like it's rude. And they're like, no, we want you to do it. We really want you to do that. Honk at us and we'll come out, or call us and we'll come out. But for the time being, we're going to take this thing like we've asked everybody else to do, slowly and with caution.
Okay, so moving on into some upcoming big social gatherings. We have our graduation parade coming up on Sunday.
We do.
Which is just going to be, kind of around...
the homecoming route is what I've heard.
The homecoming route, which means it's going to start up at St. Joe. It's going to come down to the highway, east on the highway, and then north again on 4th Street. And it's my understanding there will be an announcer in the courtyard of the courthouse courtyard saying the names of each graduate as they drive by.
Right.
Not walk by. They will be in cars doing a parade. And so just like heading into this, what are some of your biggest concerns about this event?
So the same concerns that I've had with everything since the day that the governor said we're going to release this thing on May 4th. And concern does not mean not with it, because I also believe that we have to get back. You've heard me talk about the teeter-totter. We talked about that last time. We have to find a way of living and staying well in the midst of this pandemic. So we do have to open up and we have to do some things. But it's the congregation. People naturally want to be together. Seniors in high school naturally want to be together. And so graduation has the potential to spur some pretty large congregations of people for parties and things. So, and from out of town. So I know that graduation is an important time, and I'm going to be anxious to see it, and I want the kids to have it. But I did not advocate for a traditional graduation in May. And it wasn't so much that I didn't think that the families could stay separated out here. It was what that would do as far as people coming in. So we're going to limit the number of people that go to these graduations, but there's still going to be the parties and the grandmas and the grandpas and the aunts and the uncles and the friends that come from all over the state, out of state, to celebrate this important time with these kids. And that is just a pretty high risk for the community and the family. So I was excited, not necessarily excited, I was happy that we made the choice to have our traditional graduation in July, because I do feel like June and July can bring a lot more relaxed times for everybody that's working on this stuff. But then also the parade, I think is fine. My concerns with that again are the party. So if we make this day a graduation day and we do more than just a few households in a backyard having a barbecue, if these turn into big parties, people need to understand that the risk goes up. So immediate households should be separate by 6 feet. And we really are discouraging the large congregation until we get out of at least the month of May and see where this slow opening has taken us. So I'm happy with the parade. I hope to be at the parade. My family will be standing. There's going to be a lot of room. Everybody's going to want to congregate down at the end where they can hear the names being called, but I would encourage you to space out among your families, your immediate households, all along the route. I always burn my candy in the first 3 weeks or the first 3 blocks during homecoming when we're walking through. Let's spread out and give people to cheer them on all the way through. And if we just keep that space, that social distancing of 6 feet among households, I think we're going to be better off.
And also for people who don't live here and want to see it, or for people who do live here and don't want to be out among other people, I'm gonna live stream and I will be around the announcer area.
Good.
With my camera. Just take note, if you're planning on watching it, it's going to be on the Edina Sentinel Facebook page, not the NemoNews.net Facebook page, because we do have some social distancing ceremonies that are happening
all over
schools elsewhere. Yes. Some of our other, other news paper family will be using that as their live stream. So.
Well, if Knox County families are listening to me today, I just want you to know that I'm very proud of your seniors. I'm very proud of what we've been able to accomplish over the last, couple of months. But if you can put those parties off till June and July, I'm going to be a happier camper. And I really would encourage you to do that. And personal responsibility. If there are people in your families that should not contract this coronavirus, and we've done well to protect them and take care of them for all these months, this is not the time to give that up right now. There's just going to be some people that should enjoy the outside air at home and not be out amongst crowds. So.
Okay. We talked about the parade. Okay. The last thing on my list is face masks. And I guess, tell me how you're working the cloth face masks. People have called you and said, we're making these face masks.
Right.
What do we do? And then other people who need them call and say, we need some face masks. What do we do? And you can't give them out, or you're not collecting and giving them out, but you are connecting people.
So masks are all along, that and testing have been the two big things that, at first we said, masks don't help if it doesn't help you if you're not sick or, what have you. Now we want people to wear masks, but you're also hearing in the news that it can be dangerous to wear the mask because the masks collect germs on the outside. And if people don't take them off appropriately, they touch it and then they touch their face. So what I would tell people is that if you are out and about in public and you have that potential to be within 6 feet of somebody, you should have that cloth mask on. It's not to protect you, it's to protect them from anybody else that you're around, and the chance that you are one of the people who could be non-symptomatic and carrying COVID. Other people, and then that's the scientific end. My personal belief is if I put my shirt over my face and you cough at me, I think it stops something. It's better than nothing, right? So I think it could stop something. I'm telling people that cloth masks are great. Don't touch the outsides of them. Take them off appropriately. Wash them at night. Don't wear them for days on end. Collect everything on them. Drop them in your purse, whatever. You need to handle them appropriately and wash them appropriately. We are getting some at the health department, and we really appreciate those. We're using them now. So my staff is using those. And we have a rotating, and we've got some really neat designs. So if you're a sewer out there who wants to send us some, we've got some flags, we've got some kid masks. I mean, it's fantastic. I've got one, my favorite one, it may be like yours, has a rope through it, and I can let it dangle, and then I never have to touch the front. The front goes down, I pull it back up, it's exactly like that. And that's my favorite mask. But we are happy if you're a person out there that's making masks and want to send us some. We have 8 employees, and we are happy to take those and test them out for you and try them. We love them. But there are also citizens that call and want to know where they can get a mask. So far, we've had a couple of ladies in the community that are making them. They left their name and phone number with us. And if we get a call, we just refer people to them to go get some cloth masks. So cloth masks are good, and I would encourage people to use them wisely. The other thing that came out this week is it smart to wear gloves everywhere you go? Really, you don't need to have gloves on unless you're taking care of someone sick or messing in something
or
that's
making
icky.
Food.
Yes, or making food. Gloves for just all-purpose shopping and things, you're going to be as well off to wash those hands. Get those hands washed, because gloves collect stuff just like your skin does, So just keep washing your hands, use your Germ-X in between, but nothing should replace hand washing.
Right. Girl, I feel like a crazy hand washing person who constantly washing sanitizing, washing the hands.
I think we talked this morning about, one of my friends had said to me that they were out over the weekend and it felt so good that things felt more like normal, pre-COVID. Things felt more pre-COVID. And, there are going to be some of these things that we just need to stick with for a while. I don't think the intensity and the fear, I think as we get more testing, the more all these random tests come back negative, the better I feel about things. We're coming into a time when sunlight and heat, and we're outside more and we can distance more. But we're going to be sticking with, and we should have been all along, if you think about flu, think about the people you know and how illness has dropped since we've distanced out a little bit. You know, I would predict that the plastic things that are in front of our checkers at the grocery stores, those aren't going away anytime soon, because we found new practice that is, you know, going to change things. I know we're moving at the health department, and so we're identifying things like our magazine racks and our toy box, things that can't be cleaned between. There's not going to be a place for it anymore. I mean, that's one thing that this has all taught us, that, you know, things have to have a surface that can be clean when they're used by the public. So
yeah, every time I touch a door,
yeah,
it just washes over me.
Yeah.
Like, okay, don't touch anything with this hand until I can get it washed. So, okay. Summer is coming.
Mm-hmm.
Believe it or not, you couldn't tell by the weather.
Yeah, it's warm out today. It's muggy.
It's a little. This is one of the first. I mean, one of very few warm days that we've had.
Only in Missouri do you go from furnace to central air to furnace to central air in like 10 days time. So, yeah.
And I don't know if you know anything about this yet, but I'm super curious about swimming this year.
Right.
What's going to happen with swimming? Can we do it? Is it bad?
It's ultimately going to be up to the cities where those pools are. If you're talking about
pools,
about
like the lake.
You're talking about the lake. The lakes, we're going to have to talk about that as a county, but my assumption is that they will open up and you'll be expected to social distance. You know, come June, we're still a little early on the lakes, but come June, each county commission will discuss that. Each private entity, like if it's the country club or the lakes, you know, they're all going to make those decisions themselves. What we would tell people is you need to social distance. It doesn't mean congregate. As long as we're putting space between people, you can certainly swim. And as far as pools go, there's been a lot of conversation about pools. If pools are chemically treated correctly, COVID should not live in them. And then to do the social distancing, the chairs are going to have to be apart. They're going to probably have to modify the amount of people they let in, but there shouldn't be a reason that pools don't open up. And kids need something to do. You know, we can't, I don't know how many other parents feel this way, but I don't want to fight my kids all summer with, no, it's not PlayStation time. No, it's not Nintendo time. It's time to go outside. You know, we're forcing our kids to go out and play baseball in the front yard and to take walks and get outside. You need that vitamin D. You need that fresh air. And we need some traditional summer activity. You know, the 4-H kids are working with their animals and getting ready for their fair. And that's good. We need some routine. We need some structure. And we need to not be focused on the devastation of COVID for a little while. You know, businesses are back up and going. We're just watching. We're carefully watching. And my hope by June is that if we do distancing correctly, we can get back to some of these summer activities that we all like so much.
Okay. We'll leave that on that high note.
Yes.
Leave it on a high note. So thank you so much for watching this live stream. I'm going to go ahead and shut it down for now and just start sharing it out through some of our other Facebook arenas. I'm Echo Menges for NemoNews.net and the Edina Sentinel. This is Lori Moots-Clair, the administrator of the Knox County Health Department. Thank you so much.
Thank you for doing this through the last couple of months. It gives us a chance to get out and catch up with the people.
We are insanely lucky to have you.
Well, thank you. I feel lucky to be here. So
you're a hometown girl.
I am a hometown girl. Was raised here, went off to college, not very far at Truman. Lived out of county for a while, got married, and then ended up back here. So
I have a friend in Columbia who is very knowledgeable on all aspects of health and medicine, and they all know who you are, and they have a lot of respect for you, and they've often wondered, what are you doing all the way up here? Because you could be working in Jeff City or St. Louis.
I love public health, but I also love my family, and I have a mother and father and brothers and sisters and friends, and my kids love it here. I mean, you know, that we're learning what the value of living rurally is in times like this, and you know, but I love public health, so it works out for all of us because we try and stay on the forefront of things, and I believe that the public health approach, whether in a county the size of Knox or a county the size of Boone should be strong, and so that's what we're doing.
Thank you.
You're welcome.
All right, we're setting it down for now.